And the first lecture in this session is titled Putting It Together, delivered by Mr. العزيز الباقي, the Director General of Quality and Patient Safety at the Ministry of Health. Please join me in welcoming him to the stage.
مساء الخير جميعا. يسعدني أكون معاكم في الأحساء وأشكر أهل الأحساء أخواني وأخواتي. I would like to thank also my brother Malik al-Musa for inviting us here, since we're working together for a long time for the same aim, improving patient experience, quality. Just have at the Ministry of Health, at the sorry, the slides just ran over. So what I'll be sharing with you today is the experience in the last 18 months at the Ministry of Health, the Kingdom of Saudi Arabia, and what are the efforts done just to put things together. Because we believe that patient experience is not departmentalized. It's not about the department of patient experience. It's about the holistic approach of collaboration, alignment, and working together toward the goal of improving patient experience to our patients. So, early in the middle of 2016, the initiative of a national transformation plan started in Saudi Arabia. One of the major domains of the transformation is quality and patient safety. We started working with all regions, with all care providers in the kingdom, at least to identify the challenges that we have in terms of quality, safety, including patient experience. And we came out with three main objectives. Number one is the governance. How can we improve the governance for quality, safety? And how can we set benchmarks, national benchmarks for quality and patient safety? And the last one is about improving the culture. So these are the very high level, and then we'll having some details about the objectives, including engaging patients, engaging customers, internals and external, going with full transparency and sharing the information with the internal stakeholders at the ministry and to the public. Also about the accreditation, focusing on supporting organizations as a regulatory body, the Ministry of Health, in terms of accreditations for quality and safety, patient experience, and to raise the standards, the bar for standards. Also about integration. Many organizations used to work in silo. Like when you talk about patient experience, they think that it's only department of patient experience, the quality, it's about quality departments. The hospitals in regions, they work alone and without creating that network to share the knowledge and the experience and to learn from other people's experience. We use that whenever we need to learn something, we travel to the US, we go abroad to learn from the experience of other people. How about having centers of excellence within the country and to identify these centers, and then we create that network so we can support each other's within the same kingdom. Also about the communications between organizations, communications between all levels of leadership. This is one of the strategic objectives. About decision making, supporting the leaderships in the ministry and in the country to make right decisions with the facts-based decisions. So this is one of the most important things about creating the networks of performance indicators, prioritizing the performance indicators, and to spread that culture of measurement in the Ministry of Health. The last one is about the competencies among the quality staff. So this is a very high level about when we started and when did the story start. So then in December 2015, November, December, we started with a pilot of 33 hospitals at the Ministry of Health, distributed all over the kingdom, with a project that focuses on the patient pain points in clinics, emergency departments, and the inpatients. We have created 24 KPIs, so these are the targets that we'll be focusing at, and every organization will be doing their best to identify the challenges and then to identify the initiatives to achieve the targets. When we have set some criteria of selecting the projects, like the high impact with low effort, we don't want to go with much of resources to add to the ministry. We want to utilize whatever we have to achieve the the goals that we set together. So this project took like 1 year, 12 months, with 24 KPIs. I'll be sharing with you some of the outcomes in the areas. Like along with the 33 hospitals, the bottlenecks that we used to have is from emergency to ICU admissions. The average time was for almost 14 hours, patients waiting in the ED to be admitted in the ICU, and the average early in 2017 became 5 hours. And there are still more work to be done to improve these targets. The same thing in the outpatients with the no-show, reminding patients, increasing the capacities for clinics. The next available appointment in some regions used to be 10 months, 12 months, and it was very, very long. Studying the capacity, the demand, and understand the productivity for physicians, for clinic, helps a lot into identifying how can we improve the waiting time for patients and to avail more appointments for patients in certain specialties, and that will be across the whole Ministry of Health hospitals. And improving patient experience, is it about the journey or fixing the process to eliminate the bottlenecks, to eliminate the inefficiencies, to eliminate the non-value adding steps in the process? This is the culture that we focus to spread at the Ministry of Health hospitals with this pilot. And at the end of the year, we found that there are many, many lessons learned with this. The culture, the people readiness to receive these projects was very high, and it was very good. In the beginning, we had that perception that we will face a big challenge. People will never respond, and we will face a big challenge in not achieving the target. The nice thing is that the heroes that we worked with in the Ministry of Health hospitals, they wanted more, and we have seen lots of innovations and creativities to achieve the targets by empowering them with the data, with the processes, with the required coaching and training to achieve the target. So the biggest thing I learned in this project is we need to empower the people. As the Ministry of Health, regulatory entities, we don't only provide the care. As a regulatory policy making in the country, we need to empower the frontliners to make authorities, accountabilities very clear to all levels of leadership, and then supporting them to deliver what is expected from them. The expectations for what they need to deliver is very important for this stage. After that, the project was matured, started with 33 hospitals. Now we're working with 70 hospitals, and the project name is ADAء. It's focusing mainly about efficiency, productivity. Safety, quality is another dimension that we're working with another teams. We expanded the list of indicators from 24 to 43, and it's covering 7 domains: ED, inpatients, outpatients, the laboratory, the critical care, operating room, and the radiology departments. These are the most challenges we found at the Ministry of Health hospitals that will add great value to eliminate the waste and to improve the satisfaction and to improve the access. Like Ms. Cooper used to talk about the accessibility as one of the major challenges. Everybody knows this is not something to hide. Not everybody is happy about the MOH services. So how can we improve the accessibility? How can we set the priorities to improve the access for our patients in the different levels of care that we provide? And then the roadmap, it started late in December 2016 after 1 year. And right now we are at the final stages. In 2018, project will be expanding, adding more scope of quality measures. How can we balance efficiency, productivity with safety and quality? Some teams are focusing more into increasing the productivity of physicians, of the laboratory, of the radiology department. But how about safety and quality? Are we harming our patients? How can we set KPIs to make sure that our patients are safe when we implement efficiency models at the healthcare services? We said we're implementing projects to improve quality, the efficiency and productivity, and some in quality and safety. How about our patients? So we tried so many methodologies to measure the satisfactions for patients. The patient relation department at the Ministry of Health hospitals are measuring the patient satisfaction across MOH in all hospitals. But we have some challenges and some validity issues to make sure that the data are reliable so we can make decisions on them. We have done a pilot with the help of Risk Gaining last year, including 15 hospitals, on measuring the patient satisfactions and validating the HCAB surveys with the culture of Ministry of Health hospitals. So we've added some questions that matches the needs of Ministry of Health patients. And then we conducted the survey in the 15 hospitals, and then we came out with results to understand the behavior of the data and how can we do benchmarks within the country, and we can compare it with the regions. So many lessons learned from this pilot, and we're going to expand in the very near future across all services to understand more about our patients, their feedback on our services, and how can we focus in the areas that need attention, and how can we set future initiatives to improve the services. So the response rate was 4% out of the 468 surveys done, and we met the requirements of the standards. By only focusing on the measuring the patient voice, we did not only achieve the satisfaction measurement, but we identified areas for improvements that can help our hospitals to improve. For example, the data collection process, we faced many challenges in extracting the data from hospital information system. And that was by some physicians are not entering the patient demographics properly, the registration office, the admission office are lacking some of the data in the system, and then we faced challenges when collecting the data so we can understand the patient demographics with more clarity. So by only focusing and looking at the data of patient satisfaction, we have identified other initiatives that can help in improving the quality of the data and information. So not only patient experience, but also data quality, medical record documentation, registration process, discharge summary, all of this data were benefited from this project so we can give feedback to hospitals to develop the process. The common mindset that we have in the governmental sector in general is centralized. Everything needs to go to Riyadh. The approval of the minister, the approval of the Central Ministry of Health. Now the direction for the ministry is to let go the care provision and to take care of the regulation and policy making. So right now we have decentralized from the ministry many responsibilities to the regional directorates. For example, budgeting, recruitment, the accountability measures for some major KPIs. So the regional directorates are responsible and accountable to do and to deliver, and they are empowered to deliver the services by themselves without going back to the regional, to the Central Ministry of Health. So decentralization is very important to enhance patient experience. It is indirectly, but if we centralize everything, then we'll be delaying the services that we provide to patients, and then the outcome is affecting the journey for patients and affecting the services. So the one thing that we always keep in mind is whenever we introduce any project or whenever we monitor anything, we need to set the accountability to the very top. For example, an initiative that we launched 6 months ago for quality safety to ensure that hospitals are safe in regards of the essential safety requirements for Sibahi. The ultimate accountability goes to the regional directors in the regions, not the hospital director, but not the quality director. But the authorities need to go all the way to the front line. They need to be empowered, authorized to make decisions to provide the services they are expected to do. So this is very important things that we learned about accountability and empowering staff with the authorities. Of course, also the mindset that we have about the governmental sector, appearance, work environment, the branding, it's very important. We started in right now, more than 60 MOH organizations with the new look and feel, with the new brand, with the new design. So we have standardized how, whenever you build a hospital or whenever you have an MOH organization, how it should look like. No need for inconsistent decoration, inconsistent interior design. The way we present ourselves to our patients, to the community, is very important to build the trust and to make them interested to take our service, considering the patient flow within the organizations. So we're working with Sibahi to consider the construction standards for hospitals and healthcare organizations, and part of it is the ergonomics and the workflow and patient flow within the organization itself. So patient-centric approach in every single process need to be considered, and we need to continuously consider this as an essential component. Just a few examples from some like 14 primary healthcare centers, how it looked like before and how it looked like now. And how can we empower these centers whenever we contract with subcontractors for cleaning, for maintenance? How can we embed the patient experience and quality standards along with this contract? So whenever we review the contract, it will become an essential part of contracting with these organizations or companies. One thing that also the ministry launched last year is the mystery shoppers. How can we assess these services? So we've created standards. These standards for the mystery shoppers. Mystery shoppers are volunteers from the community and from healthcare workers and for patients. So they volunteer to the ministry, and the ministry is training them about the standards that they will be considering during their journey getting their services in the primary care, in hospitals, in the administrations, in the regional directorates. So when they go and visit, they will come out with a report about how they see the service, and then they will introduce themselves to the hospitals. That I'm a mystery shopper, I'm introducing myself to you, and this is the report that we have found in you. And we benefited a lot with these reports in improving the service and giving feedback to the regions and organizations to enhance and improve the services. So you see the level of engagement here is not only about CEOs, ministers, and patient experience directors. It's about the whole leadership team need to keep that in mind. For example, the patients see that the bathrooms are not clean, or they see that the wheelchairs are not available, or the waiting area seats are broken, or they're not even enough. So this feedback is very important to the engineering teams, so they can understand they can continue taking care of their contracting and monitoring the contracts that people provide to healthcare workers. So even engineers, HR people should be looking at this report so they can contribute to enhance the process. Also last year we have the Innovation Center. It's the new division at the ministry, and we have a very passionate team about innovation, introducing the human-centered design, the design thinking approach. Whenever we design any process, whenever we accommodate any idea, we have created the idea bank. We make big announcements to all MOH staff. We have 250,000 staff across the kingdom. So whoever have an idea to improve the patient experience, whoever have an idea to improve the processes, please submit your ideas. And we have a judging team. They work in shortlisting the ideas, and then the minister himself, 2 weeks back, rewarded the best ideas. And every owner of an idea in the ministry took that in the table to improve and to implement the presented ideas from the team. And the idea of the Ruwad Award is only specialized on the patient experience for the Ministry of Health. So Ruwad Award is only for patient experience ideas. How Ministry of Health staff think they can improve the patient experience, and whenever they think there is an innovative idea that was implemented somewhere, they can introduce it, and we can help them to spread all over the organizations. And we learned a lot with these teams by seeing their ideas, seeing their perceptions, and how do they perceive the leadership team and the ministry supporting them and taking them from hand by hand. Another award that was very nice award, Wa'i Award. It was introduced by Ministry of Health and the Mara'i company. The Mara'i, it's a milk company, dairies. And we received more than 400,000 ideas, like movies, infographics, short movies about patient experience, about medication errors, about healthcare experiences. And 100 people from these participants have awarded 6 months ago. And then we will continue using their ideas in spreading the awareness and education materials through the social media and through the MOH website. Until now, like 60 ideas from these were published through the Twitter account of the Ministry of Health. From these people, they volunteered their ideas to enhance the healthcare services. Of course, 937, we Ministry of Health have 937 line. It's about calling for complaints and consultations. Last year, nobody knew about 937, and we started spreading the announcements, advertisement about please call 937 if you have complaints, inquiries, medical consultations, or any violations that you see regarding medications, compliance, regulatory policies. You can call 937 and give your opinion. So, and we started publishing the reports of 937 about the satisfaction of callers and the closure percentage in every region. So every region we publish the report to the public through Twitter account and through the website. What is the satisfaction in every region and what is the closure rate for every region. You see, we started here. Last year we have the closure rate 5% of our complaints nationwide. Now we reached more than 90%. With the satisfaction about the closure, it used to be less than 50% and now we reach more than 80%. Like when people complain at 937, we send it to the region and they solve the complaints, and then we have a quality team calling the people who complain to make sure that they are satisfied with the solution. If not, we'll make the complaints open and we raise it and we escalate it to the responsible people. And by this, everybody is accountable for the services rendered to our patients. For example, if we have a complaint against medication shortages or a vaccination shortage, they will complain to 937, and the supply chain people, leaders, are the ultimate accountable people to solve this problem. And many of the problems we found is not shortages, is bottlenecks or supply chain process improvement that need to be provided to patients. So engaging the leadership team in seeing the patient reports and seeing the patient complaints and the satisfaction reports added a great value in improving the experience for our patients. And we also work with the HR people about the type of complaints we receive for communication, delivering, setting up the training needs in the future in every region. Every region have its own sensitivities and its own culture, so we cannot have a one-size-fits-all across the ministry. Every region has its own needs and its own requirements. Out of these complaints, and out of this feedback, and out of these consultations and inquiries, we produce the awareness program and awareness materials, again through the social media and through YouTube and through the channels of education and awareness. Even we go to mosques to educate and spread the awareness to the public, utilizing the 937 data that we receive on a daily basis, 24/7. Of course, about staff satisfaction, we have a big issue about governmental jobs, people who have issues with their staff satisfaction, so we created the number similar to 937, but to MOH staff. So they call this number, they set their concerns. What do you think? Is it a grievance process? Is there a shortage in the services that we provide? Do you feel that you are not treated fairly in your organization? And we treat this in a very confidential way, and then we try work with the leadership to fix and to improve the process and to set KPIs to make sure things are not repeated in the future. The last thing about the private sector, we worked with the private sector in the last year in the value-based healthcare about the purchasing model. MOH purchased services from the private sector, so we agreed about list of KPIs, engaging 80 hospitals from the private sectors all over the kingdom. What do you think are the KPIs that you need MOH to evaluate your organization? So we collected the feedback of the 80 private hospitals from all over the kingdom, and we prioritized the KPIs, and you see patient experience is one major component of the dashboard that will be measuring the private sector performance through MOH. Of course, what I presented today is about putting it together. Like, we believe that patient experience is everybody's responsibility. Patient experience is not the patient experience department responsibility. It is the responsibility from the very top to everybody in the organization, and we need to put all factors together to identify the patient needs and to work hard continuously to identify their needs and to improve the services that we provide to our patients. And when we look at the KPIs, it's not only about the numbers. Every KPI that we look at has a story behind it and have many stories for patients and families. Even they suffer about it, or they are harmed by our services, or they have positive experiences. So when we look at the KPIs, we need to make it more emotional, more humanistic, so we can improve our patient experience. That's all for my presentation. I'd like to thank my colleagues at the Ministry of Health because I'm presenting their work. It's not my work. And I would like to thank Al-Ahsa people for inviting me with them today. Thank you.
Thank you. Thank you indeed, Mr. Abdul Aziz Abdul Baaqi.